All right, we're going to move on to the biometry section, and I'm going to keep this pretty short and just go over the basics because we have an entire lecture just on biometry itself. The key thing about biometry is that it's critical to know how to measure these correctly and to do your best to try and do it the exact same every time. Why is this? Because crucial decisions are made on the basis of these measurements. If you've tried to make these measurements or you're learning how to make them, you know that they're not always easy to get the exact plane, and we'll talk about how to work on that later. But it's good to know that you don't need to correct every slight error that you may make, or every error inherent in the ability to get this perfect plane of section. But it is important to know what error was made and what the magnitude of that error and the direction of that error is. And in order to understand that magnitude and direction, you must know what the correct landmarks are for each of those images. So the four biometric kind of standard measurements that most people make are the head circumference, the biparietal diameter, the abdominal circumference, and the femur length. So let's go over each of those. The head circumference criteria is that the cavum septi pellucidum should be in the picture. That's the first arrow here. The thalamus, this sort of heart-shaped structure, and the tentorium of the cerebellum, or the cerebellar tentorium, not the cerebellum itself. And you want to measure as tightly as you can to the bone. So is this the most perfect measurement? No, we have the landmarks. They're perfect. But what we see here is that this isn't exactly tight to the bone. So fixing that is not going to make a huge difference, but you could know that, all right, I slightly over measured it if it were necessary to assess that. The errors that people tend to make are measuring to the skin rather than measuring to the bone. And as we mentioned before, including the cerebellum in your landmarks rather than the tentorium. And some people will call this sort of a picture, like they think of it as an arrow, where these are the feathers, this is the shaft of the arrow, and the tentorium is the head of the arrow. So you should not see the cerebellum in there. If you see the cerebellum, you're too oblique and you're going to be over measuring the head circumference. Most people will typically use basically the same, if not almost the same picture to measure the biparietal diameter, which is fine. The criteria for the bipyramidal diameter are actually a little bit easier because it only requires that the third ventricle be present, flanked by the thalamus here. And again, it can be similar plane to the head circumference, which we'll often use, but any plane that satisfies the criteria where the third ventricle is flanked by the thalami is good enough. So you can actually measure it in a coronal plane if you are having trouble getting an appropriate window or something like that. You can either measure to the outer wall of the anterior bone to the inner wall of the posterior calvarium, or you can measure from the bone to the bone. Either is okay as long as you're consistent. The abdominal circumference, this is probably the hardest one to measure. You want to see the portal venous confluence, which is this sort of curve here. This is the left portal vein coming up into the umbilical segment. And you want to see the shortest length of the umbilical segment of the left portal vein, meaning you don't want to see it going into the umbilical vein here. If you're going into the umbilical vein here, you're too obliqued. The lower ribs should be symmetric. The stomach should be present. And again, you want to, and your outer circle should be measured tight to the skin. Sometimes it can be somewhat difficult down in this area, which is why we're showing this picture here. If you kind of look out here, here's the rib, here's the degree of skin anterior to that rib. Probably should stick to about the same amount posterior to that rib. So maybe this could be a little over measured, but it's hard to say. One tip that we will give you is that, as Roy likes to say, roundness makes up for a multitude of sins. So if you can get a picture that's round in the appropriate, near the appropriate plane, you're probably dealing with a pretty good assessment of the abdominal circumference. The problems most people run into are measuring either too oblique, like we said, involving the, usually you'll see the entire umbilical vein running out in the picture here. That's too oblique. You're not tight to the skin, or you can't see the skin posteriorly, or you just straight up have the wrong landmarks. You maybe don't have the portal vein confluence in the picture. Moving on to the femur length, the criteria is simply you measure the ossified femur. So how do you know if you're dealing with the ossified femur? Well, you want to identify the cartilaginous head of the femur and the cartilaginous femoral condyles. So if you kind of draw some little ovals here, you know where those are, and you're going to measure the ossified portion from there to there. One trick or one problem people can run into is measuring the what we call the distal femoral point. You're not seeing it really well here, but there's off of the femoral condyles, you can get a specular reflection here, and you can think that this may be the ossified portion of the femur, and that you will end up over measuring it. Again, we're going to cover this a lot more in detail in the biometry lecture itself. And then finally, you're going to be faced with a biometric table. And these tend to look pretty similar. This is just one off an old Accuson machine. Actually, it might be off a Siemens machine, either way. It has the information that you're going to most need to deal with. These are all the individual biometric averages and where they fall in their gestational age. You're going to basically want to focus mostly on this area right here. We've got the clinical dates, which can be based on your the woman's last menstrual period, or you can actually type in an estimated due date based on previous scan. But in any case, that's going to kick out your clinical dates. So in this case, the clinical dates are 20 weeks and 1 day. Down here, you're going to have your ultrasound estimated gestational age based on your biometric measurements. And in this case, it's 19 weeks, 0 days. And we see here that there's actually, size is actually 8 days less than dates. So interpretation here would be that size is 8 days less than dates. Now, we could be off on our dates clinically. The baby could be small. We don't necessarily know without previous report. And again, we're going to cover a lot more how to interpret that and how to deal with that on our later lectures. We'll also deal with, what happens when you see the femur being a little shorter. Is it really abnormal? Is it just a short mother? And at some point, we'll also cover some of these measurements, calculations, and what slight variations in this tell you and where they should point to you. But for the basic biometry, you want to know those landmarks, and if you know the landmarks well and you make a mistake, it's not the end of the world. You just need to know that, okay, if the baby in this case was coming out a little too small, you might go back and check your measurements and say, did I make all my measurements correctly, or did I undermeasure something? And if I did, then you know that's going to be contributing to this outcome here. And I think that's it for biometry, and we'll move on to the next section.